Our next speaker is Dr. Nick Nassikas. He's an instructor of medicine in the Division of Pulmonary and Critical Care at Harvard School of Medicine. And he'll be talking to us today about the influence of our environment on childhood respiratory health.
Hey, everybody. Thanks for having me. I'm really excited to be here, talk to you all. Probably cover some of the same sort of studies and topics that have already been discussed. But one of the things that I want to talk about is air pollution, really in the context of climate change and in the future. And then I'm looking forward to the discussions afterwards. So in the next 15 to 20 minutes, my objectives are to briefly discuss the relationships between pollution, precipitation, and pollen on childhood lung health, particularly asthma. And I'm going to start with pollution and really emphasize how climate change will influence future pollen concentrations and affect lung health. It obviously comes as no surprise to this audience that greenhouse gas emissions cause global warming. Global warming promotes ozone air pollution formation. Nitrogen oxides, VOCs, form ozone in the presence of sunlight and heat, and obviously that's getting worse in the future. And the effects of global warming on ozone formation may actually dampen future progress we make on reducing emissions, as illustrated in this figure showing California projected out to the year 2050. And the slide is from John Balmes, who talked earlier today. Future concentrations of ozone air pollution vary geographically and vary based on the climate model or emissions inventory used. And here in each column, we see future ozone concentrations for 2030, 2050, 2075, and 2095. And the top row shows future ozone concentrations based on emissions from 2011. And the bottom row shows future ozone concentrations based on projected emissions for the year 2040, which assumes fewer emissions compared to the 2011 inventory. And then by comparing the two different emissions inventories, one with higher emissions, one with lower emissions, we can actually start to understand how reducing emissions in the future can have a benefit on health. And so we use this concept of two emissions inventories for work by the US EPA that I was involved in. And we showed that lowering emissions in the future could avoid thousands of ozone attributable deaths every year in the US. And the top figure shows ozone attributable deaths under the higher emissions inventory. And then the lower figure shows lower emissions inventory on a county level for 2095 compared to the year 2000. And this work is in adults, but we can apply a similar approach to childhood respiratory diseases such as asthma, as I'll show in a few slides. And we know that short-term exposure to ozone is associated with childhood asthma emergency department visits based on prior studies, including the one I'm showing here. In this figure, we see higher rate ratios of pediatric asthma ED visits on the y-axis and concentrations of ozone on the x-axis. And one of the things I want to point out is that at ozone concentrations below the current short-term ozone national ambient air quality standard of 70 parts per billion, we still see an increased risk of asthma ED visits. So similar to the concept of comparing two different emissions scenarios, we can look at two different climate change models that take into account greenhouse gas concentrations called representative concentration pathways, or RCPs. So RCP 8.5 assumes business as usual in terms of ongoing greenhouse gas concentration increases, and that would project catastrophic warming by the year 2100. And then RCP 4.5 assumes more drastic cuts in greenhouse gas concentrations with warming of about 1.8 degrees Celsius by 2100. Which obviously is still above our Paris climate agreement of 1.5 degrees Celsius. And the figure on the left shows the years on the x-axis and global surface temperature changes on the y-axis. And the curves represent the different RCPs. And the figure on the right shows the temperature changes by the end of the century for the US based on the different RCPs. And using these models, we can understand how childhood diseases may be impacted under these different models. So in this study, we looked at differences in ozone-related asthma ED visits on the two RCPs, RCP 8.5 and RCP 4.5. And in the study, we estimated hundreds of additional pediatric ozone-related asthma ED visits under the business as usual model, RCP 8.5 compared to 4.5, really by mid-century, 2050, centered on 2050, but really for the decade 2045 to 2055. And this figure is for all ages, but as you can see, there's really geographic heterogeneity with the central US and southwest US having the large number of additional asthma ED visits between the two models. And obviously, it's not just ozone that's going to be impacted by climate change. Climate change is also driving more wildfires, as we're seeing. And wildfires contribute more than a third of the total annual burden of PM 2.5 in the US. And this is almost certainly going to increase in the future. And so echoing the ozone story, despite a lot of progress that we've made on air quality through regulations, emissions reductions, air quality has actually worsened in wildfire-prone areas in the Northwest US over the past 30 years. And this is largely the result of wildland fires in the US and Canada. And as you all know, residents in the Northeast, where I live, have also been experiencing degraded air quality recently from the wildfire smoke coming up down from Canada. And this is going to be a very frequently referenced paper or cohort. So in this study from the Southern California Children's Health Study, reductions in PM 2.5 were associated in decreased childhood asthma incidence. And the different colored lines represent the different communities in the study. And then the communities with greater decreases in PM 2.5 between 1993 and 2014 also had greater reduction in asthma incidence rates over that period of time. And there's also growing evidence that PM 2.5 is a cause of incident asthma. So using the emissions inventories I mentioned earlier, we estimated future PM 2.5 attributable incident asthma for the US. And by the year 2030, so quite soon, we estimated 38,000 additional PM 2.5 attributable incident asthma cases per year, increasing to 200,000 additional cases by 2095 relative to the year 2000. And under the lower emissions inventory compared to the higher emissions inventory, we estimate thousands to tens of thousands of avoided PM 2.5 attributable incident asthma cases per year. And then that would, that's by early century, and then by later century, tens of thousands of avoided cases. And this figure shows future PM 2.5 attributable incident asthma cases in 2095 relative to 2000. And one thing that I think is important to point out is that this is based on PM 2.5 projections that the EPA uses for health impact assessments that actually don't take into account wildfires because they've been considered an exceptional event. So this almost certainly underestimates the future effects of PM 2.5 on asthma. Switching gears slightly, climate change also influences precipitation patterns across the globe, as obviously many of you are aware, especially here on the East Coast. And with each degree of warming, precipitation patterns will change. As a warmer atmosphere holds more water vapor, which also happens to be a heat trapping gas. And this figure shows the annual maximum daily precipitation across much of the globe. And heavy precipitation will generally become more frequent and more intense with additional global warming. And those increases in rainfall will not be equally distributed. So in the US, the interior West will see hotter, drier conditions, with the Northeast and coast seeing hotter and wetter conditions. And across the world, including here, periods of drought will be interrupted by heavy precipitation events, including tropical cyclones. And so prior studies have described associations between tropical cyclones and respiratory hospitalizations. So this figure on the lower figure by Parks shows an increase in respiratory hospitalization rates in the days following tropical cyclone exposure among US Medicare beneficiaries. And on the x-axis are the percentage change in hospitalization rates, and on the y-axis are the 0 to 7 day lags after the exposure. And they found that tropical cyclone exposure was associated with increases in hospitalization, obviously for the respiratory diseases, as well as for infectious parasitic diseases and injuries. And then prior studies have also described associations of thunderstorms and rain with asthma exacerbations. And so this is a study by Grunstein, and assessed the association between thunderstorms and next day asthma ED visits in Atlanta. And they stratified the results by rainfall amount. And the figure shows the relative risk of asthma ED visit on the y-axis and thunderstorm exposure, including thunderstorms stratified by rain, on the x-axis. And what they found was that there was a higher relative risk of asthma ED visits in the day following thunderstorms with rain, but not on days where there was thunderstorms without rain. And so it really suggests that rain is playing a big role here. So in addition to cyclones and thunderstorms, climate change is expected to cause more frequent heavy precipitation events. So in this study, heavy precipitation was defined as greater than the 95th percentile and higher for historical average. And asthma exacerbation was defined as having systemic steroid prescription in addition to a diagnostic code for asthma exacerbation. And among 10,000 children in the Philadelphia metropolitan region, the odds of an asthma exacerbation were 11% higher on days with heavy precipitation compared to days without rain. And the associations between heavy precipitation and asthma exacerbation were strongest when counts of grass pollen were the highest. And so one hypothesized mechanism for this is the association between precipitation and asthma exacerbation really relates to mold formation, pollen grain rupture, fungal spore release, which can occur within hours to days of rain. And while pollen grain concentration decreased significantly during rain events, pollen fragment concentrations actually peak during rain events and persist for several hours. And these pollen fragments are really small and allow them to penetrate deep into our respiratory tracts and most likely cause airway inflammation. So exposure to pollen, fungal spores, and mold may lead to these asthma exacerbations. But it's also possible that precipitation itself affects things like FeNO, airway inflammation, a marker of airway inflammation, lung function, and asthma exacerbation. So in the United States, the Northeast region is projected to have the highest increase in mean annual precipitation compared to other regions of the US, as shown in this figure. And the hatching on the figure shows that more than 50% of the models show a statistically significant change, and more than 67% agree on the sign of that change under the different RCPs. And we looked at short-term exposure to precipitation and FeNO in generally healthy adolescents from the Project Viva cohort, which is a longitudinal pre-birth cohort based in Massachusetts. Mothers were recruited and enrolled during their pregnancy between 1999 and 2002, and then followed. Now we have kids that are older than 18 years old. And using spatially and temporally resolved daily precipitation measurements from PRISM, which is a 800-meter resolution climate data set from Oregon State University. These exposures were linked to geocoded addresses, and we analyzed the 1, 2, 3, and 7-day moving averages for precipitation preceding the study visit. And we compared that to spirometry and FeNO and found that short-term precipitation is associated with higher FeNO in generally healthy adolescents. And we also found that the associations of precipitation with FeNO were greater in those with asthma or in those with outdoor air allergen sensitization, which we defined as an IgE against ragweed, oak, ryegrass, or silver birch, which are common sources of pollen in the Northeast. And in this table, you can see that short-term precipitation exposure, really rain, in the preceding 7 days was associated with higher FeNO and lower lung function in adolescents with asthma. And as I mentioned before, it's possible the association between precipitation and FeNO is mediated by pollen, which I'll talk about a little bit in the next slide. So as has been mentioned, climate change is creating conditions conducive to pollen production. So not only are pollen seasons getting longer due to climate change, pollen concentrations themselves within the season are increasing. And this is due to elevated temperatures and CO2 concentrations, which have been found to increase pollen production. And this figure shows the future climate change related increases in daily pollen across the US. And each panel represents a different type of pollen. So from left to right, we have deciduous broadleaf forest, evergreen grass, and ragweed. And the red, yellow, and orange shading all represent increases in pollen. And these changes in pollen season have implications for asthma care. So this figure shows the exhaled nitric oxide levels before, during, and after the pollen season in 21 children ages 6 to 16 years old with seasonal allergic asthma sensitive to grass pollen. And the levels are compared to sex and age matched healthy controls. And what you can see is the children with asthma were shown to have a twofold increase in their baseline FeNO level during the pollen season. And in a systematic review and meta-analysis, authors found that for every 10 grain per cubic meter increase in pollen concentration, there was a 2% increase in asthma and allergy symptoms. Asthma medication use also increases during the pollen season. And then if you put that in the context of climate change, a recent report from the US EPA showed that increases in oak, birch, and grass pollen are associated with increases in pediatric asthma-related ED visits from 17% each year with 2 degrees Celsius of global warming, up to 30% with 4 degrees Celsius global warming. And despite common perceptions, there really isn't a well-established association between short-term pollen exposure and lung function. So one study in Australia looked at tree pollen and lung function in a birth cohort of children with a family history of asthma or allergic disease. And they found that short-term exposure to pollen from 3 different tree species was associated with reduced lung function between 1 to 3 days before the lung function was measured. And then animal and in vitro studies suggest that there may be synergistic effects between air pollution and pollen, where air pollutants actually bind to pollen grains, precipitating faster release of the allergens, increasing allergen absorption into the lungs, and potentiating the allergenicity of pollen. And in this study among 8-year-olds from the Paris cohort, children with higher grass pollen exposure and worse air quality had lower FEV1 and lower FEC compared to children with lower grass pollen and good air quality exposure. And still, as reported in a systematic review, there is overall low quality and limited evidence for synergistic effects between the simultaneous exposure to pollen and air pollution. So what do we do about it? We're, for me, I'm an adult lung doctor, but for those of you that are seeing, also seeing patients, that I feel like that's always the next question is, well, okay, we know it's bad, but is there anything that we can do? So HEPA filters, which gained a lot of attention during COVID because they can filter SARS-CoV-2, can also filter air pollutants and air allergens. And so HEPA stands for high efficiency particulate air filter, and it removes about 99.9% of airborne particles down to a size of 0.3 microns. And that can filter dust, mold, air pollution, bacteria, pollen. And if the HEPA filter also comes with a carbon filter, it also can remove gases like nitrogen dioxide. And HEPA filters have been shown to decrease air pollutants such as PM 2.5 in the home and school settings of kids. And even if HEPA filters reduce these air allergens, it had been a little bit less clear whether or not there was a clinical benefit. So did symptoms or lung function improve? And 2 systematic reviews and meta-analyses showed that HEPA filter use was associated with fewer asthma symptoms, higher peak expiratory flow rates in people with asthma. And in a recent study, HEPA filters installed in the classrooms led to lower mold measurements, which corresponded to improvements in lung function. HEPA filters also offer an intervention to reduce exposure to environmental triggers such as pollution and air allergens, but I always think that it's important to mention that costs can be prohibitive for a lot of these. So take-home points. It's clear that lowering greenhouse gas emissions will improve air quality and benefit childhood respiratory health. Extreme weather events such as rain, heavy rainstorm events, tropical cyclones are linked to worse asthma symptoms and outcomes. And pollen seasons are getting longer and more intense, which has implications for asthma control. And HEPA filters may offer a potential intervention for those that can afford it. And a lot of the work that I do, I just want to thank my mentor, Mary Rice, and her Institute for Lung Health, and also the mother, women, and children involved in the Project Viva cohort, who I think that cohort's really inspired a lot of work in childhood respiratory health. So want to acknowledge them as well. And I'm the first person to be done 2 minutes early.